sometimes we checking each other. But last podcast, so let's hear from you, first of all, how it's going on for everything.
It is definitely better days, Dr. Amafo. Things are getting much better state. And today, even I had to meet my counselor with my private clinic, and they were quite happy to see me happy. So things are definitely going great, the way I see it. As days goes by, starting from the day of the surgery and the recovery phases one by one, definitely we are in a better spot now. So clearly I said, yeah, it is time. Maybe I can invite few friends from all around England and around the world. And even if we find time, some of them might even join us and ask few questions if they're interested. Of course, the topic today, I said maybe I will pick up and have a scientific approach, ask you something about it. It's a topic which usually trans girls feel shy to talk about, but there is nothing to shy to talk about. It's more about the breast. It's more about how it really helps a transgender journey, how it helps the transition process physically and emotionally. And it may not be not always about just about a fashion and style and the looks. It may sometimes be also about the emotional journey. It's about the maternal part of the feelings, and it is something which trans people should own and take as a topic. And that's one of the reasons I felt it would be nice to talk to, nice for us to just go around and discuss the topic today. So yeah, I leave you there.
Yes, the every part of let's say MTF, male to female surgery. So it's FFS is just being part of this. There is BFS as a top surgery, the other parts of it. In every part, yeah, physically and with all your heart, you should start to feel as you are breaking the chains, you are getting out from the jail. But if you are in the wrong way, and if you are not ready enough as psychological factors about your social life, I mean, transgender means it's just not just feel like, you feel like today you feel like woman, tomorrow you'll feel like a man. It's not that. It's just a reality of the life. So if you are hug into this and you accept what you are, so it starts to being you are in a jail. So every part of this surgery, with your psychological preparation, it's being like this. So you see you are in the true way, you are going on the true way. So you are having a good surgical team, and also the gender affirmation is not a surgery only. You have gender GP in UK, right? So they are supporting in every part of this. So preparation, the surgery, the post-surgical areas, it's all is important in every step of it. So yes, we are trying to prepare our patients, and we are being sure that it's not just it's not a trend. It's a real thing of the social life, the real thing of your life. So we are checking and we are being sure if the patient is looking for a trend or she is really ready for this. So also, if in that country, if in her country, if there is some companies, some organizations, let's say, like Gender GP, we are trying to have, for now, their report, their contact. So after that, mostly our patients are giving this report and they are contacting us with that organizations. So we are being sure we are having that reports, and we are supporting with our surgical reports and post-care reports. So when you go back to your country, you are having continuously service of it. In our country, about surgery, in your country, about post-surgical periods.
Brilliant, Dr. Emma. That's really a great way to put it together. It follows pretty much the guidelines, international standard guidelines, as we can see from WPATH, and taking into consideration every country's best practices and guidelines towards gender transition, and then adapting them into your surgical practice is something which we really appreciate from the transgender community. Having said that, maybe we can quickly dive into the topic for today, which is more about the breast augmentation. As we know, transgender care is nothing new. There are a lot of discussions around the world about it. But if you look back in the history pages, especially back to 2000 years of history, especially in the Mayan civilization, Central American civilization, or of course, Greek, Egypt, and Turkey has got a rich civilization. Even looking back, and even the Indian civilization, Chinese, when we go back in history, we can see this has been, dental care is nothing new. It's been there, existed for centuries and thousands of years, and that's exactly, well, it's just the science behind it, and the way we do things have changed, but the concepts have always existed, and trans people have always existed. And yes, there have been blips in history here and there, and there have always been struggles, but still we have carried on. So carrying on that good work, especially on the breast augmentation procedures, which pretty much has become part of trans feminine life journey these days. What are the techniques? How should we start? Because the HRT starts pretty much earlier, and that helps to form the initial breast tissues. So a lot of questions around when should I do breast augmentation? Is that required? What kind of results will the breast grow afterwards? How can we, and which is the right, a lot of trans girls do ask me time to time, and sometimes about the surgical techniques. And yeah, there are a lot of brands around that when it comes to implants, which one to use, which one to choose, which shape to go for, how much to consult the surgeons, and these are the questions which come up. We would like to hear your views on it. You have been quite a lot of, you've come across a lot of surgeries, you've been quite experienced for years, and you've got a huge circle of friends and surgeons, and you might have come across a lot of these procedures. We would like to hear about the procedures and some of the details and even the risks and how we can manage those risks. The table is all yours, so I leave it to you now.
So, yeah, the breast augmentation history is elder that human history, like human history. You know, when you are telling about this, I just realized that it's kind of has same history with high heels, you know, all the time. Yeah, in history, yes, people start with the augmentation of butts, augmentation of breasts to look for the other gender, like a more feminine, like a more attractive. It's kind of being the parts of this. So it starts with the supportive breasts first of all. So then it turns into some ancient surgical methods. So we are not started with breast implants. Actually, there was no breast implants before, so it started with the injection of something. I mean, really something in the history. So yeah, ancient civilizations have examples of it. So in time, yes, it starts with that, and in time, like 1 century, 1.5 century ago, I think it was 1870s or 1860s. With Mr. Nober, Adolf Gustav Nober, started with the fat tissue transfers, not for the breast, but he tried to reconstruct some injuries on arm with fat tissue transfer. So then people start to realize the fat tissue transfer is real. So there was no standardized industrial products like breast augmentation implants, but they start with that first of all. So that fat injections turned into giving shape to breast or body. They were tried actually, but you know nowadays they are becoming trends like BBL, like breast augmentation with fat tissue, body shaping. We suppose that it started new as a trend. Basically, when we find out the new papers academically, and when we track them all to the history, so we realize that nothing is new in the world. Everybody tried something in the past, but they were not effective actually. So they found their place as an academical papers on the dusty roofs. So then we get them back and turned into trend since because the operation rooms we change its status like general anesthesia, the tools that we use in the hospitals. So we start to get encouraged to everything with the invention of penicillin when we start with antibiotics. So the surgery could become more easier and the sterilization techniques. So we are doing everything right now. Still, it's risky, all of those, yes, but not like the history. I can bet that. And the old ancient tablets are telling those, most of them ending with death after surgery, even they inject anything, because there is nothing. You just try your luck and you die for breast augmentation. Like maybe, if the Cleopatra dies, surgical treatments. Actually, according to ancient data, she and other wives of pharaohs, so they are having surgeries. It's not a joke. It's reality, actually, in the ancient Egypt. So this means, think about that. Maybe Cleopatra has died because of the surgery, so we have nothing about the lady. Maybe there was Cleopatra has died before for this, but it started with that brave hearts. So there was some surgeons are trying to do everything they want, but it was like trying your luck. But for today, we really have the power of the knowledge. It will be much better in the future. So we prepare everything and we have proofs in the medicine. It's not just trying your luck. It's not just trying yourself, your surgical practice or the patient. There's a standardization as a sterilization. So we're reducing the risk of surgical success or unsuccess of the operation. So we are setting up a good facilities. We are having trainings about this, and we are upgrading the surgery all the time. So right now, my patients are asking for up surgery with FFS or BBL surgery with FFS. I say, yeah, we are doing this, and then they say, isn't that risky? I mean, yeah, that's risky since it's surgery, but we are doing it with well-trained experience and well-trained staffs in the hospital and well-designed facilities. It's not a kid's toy, so we are knowing how it's risky, and we are reducing and controlling this. So yes, the past, you cannot imagine this, how many people has died for this, but for now we we have that experience, so we are going on. And for FFS, it's just looks like new trend, but in my opinion, it's being the liberation of the pride for now, because people start to support and accept this with the surgical success. Otherwise, they were looking that it's forbidden. But for now, looks like surgical trend. But because of that surgical trend, people are accepting this. People are being part of this, and people are has to support gender affirmation. They look like, they act like, but in the end, they do like this.
Thank you, Dr. Emma, for that. It's really a kind of in-depth answer and pretty much touched every topic. And nice to know the science facts, nice to know the fun facts as well. So nice to know the history behind it and the level of contributions which have gone into where we are with science today, and how our surgeons have achieved success and how that success helps transgender life journey is just amazing when we look back. With regard to particular procedures of breast augmentation, they do talk about things like under the muscles. Sometimes you have to reconstruct the breast tissues, and then they also talk about few brands like, what do they call it, Mentra and I like a few other. So, what exactly is the preference, and how to go about it? Is the question which pops up in the minds of many girls when they go through this journey. And then, how many days of rest do I require? When can I go back to work? And when will the breast start to settle down, and kind of I will be able to move into my regular uh, exercise routines and heavy workload or kind of strenuous things? How many months is it going to take to kind of settle down into its right place? And beyond that, these days, even trans communities and trans people, they sometimes go for, of course, their own life journeys, their own families, and then comes the question of, will I be able to take care of my child? And is, if I do a breast augmentation, how am I going to do that? These are the questions which come up into girls' minds when they start this journey. So I would like to hear your views on it, and from your experiences, if you can share some here, please.